U.S. COVID-19 testing entry requirements for international travel. U.S. entry requirements. Starting on January 26, 2021, the Centers for Disease Control and Prevention will require: opens in a new window all customers ages 2 and above traveling to or connecting through the United States to present proof of a negative COVID-19 test taken within 3 days before departure and sign an attestation confirming a negative result. Some frequently asked questions of people planning to travel to United States.
When does this order go into effect?
1 a.m. ET on January 26, 2021. All flights entering the U.S. will require all customers ages 2 and above to have proof of a negative COVID-19 test taken within 3 days of departure and signed attestation form.
What types of tests are accepted?
Are molecular test, nucleic acid amplification test, RT-PCR test, LAMP test, antigen test. Note: antibody tests are not accepted.
How long before departure must the test be taken?
If a customer is arriving on a direct flight to the U.S., the negative test must occur within 3 days of the direct flight's departure. If a customer's itinerary includes one or more connecting flights, the negative test must occur within 3 days prior to the departure of the initial flight, and the connection time cannot exceed 24 hours.
What happens if I haven't taken or received results from a COVID-19 test within 3 days of my flight's departure?
Customers who have not completed a test and or do not have a negative test result will not be allowed to board their flight to the U.S. in accordance with the CDC order.
What happens if the COVID-19 test is positive?
Customers who receive a positive test result will not be able to fly and are advised to follow the guidelines in the country where the test result was received. CDC guidelines, opens in a new window state that any customer who tests positive should self-isolate and delay travel to the U.S. until they have recovered from COVID-19.
What happens if a flight is delayed and the COVID-19 test falls outside of the 3 days before departure requirement?
The CDC order requires that customers whose test has been taken outside of the 3 days before departure requirement must be retested and obtain a negative result prior to departure to the U.S.
Does this order apply to those who have received the COVID-19 vaccine?
Yes. Customers who have received the COVID-19 vaccine must still present evidence of a negative test result taken within 3 days before travel and sign an attestation confirming a negative result. Proof of receiving the COVID-19 vaccine does not exempt customers from testing requirements.
Who is exempt from the testing requirement?
Low list includes those who are exempt from the testing requirement: children under 2, federal law enforcement and military personnel on orders, customers returning from U.S. territories. Additionally, for the negative test requirement does not apply to customers who recently had COVID-19 and can provide both a positive COVID-19 test result dated within 90 days prior to travel and a letter from a healthcare provider or public health official that states they are cleared to travel.
Are U.S. citizens required to get a COVID-19 test before traveling to the U.S.?
Yes. All customers, including U.S. citizens and legal permanent residents, age 2 and over flying from an international destination to the United States must obtain a negative COVID-19 test result within 3 days of departure and confirm their negative result by signing an attestation form.
Our aim is to provide you with the latest deals and information related to airlines and flights of United States. Talk to us to know more.